Hi, for all those, welcome to the webinar. My name is Patricia Friedrich. I am the primary care coordinator for the Community and Public Health group within AMSA. And welcome to our first webinar for National Primary Care Week. Woohoo! This webinar is called Climate Change, a Health Problem of Concern to Primary Care Physicians. And just to let you know, there are other events going on this week. If you go to our National Primary Care Week webpage with AMSA, the other events we are having include physician gag laws, fracking, coal and climate change, and solutions to renewable energy resources. And also just to let you know, if you have questions for the attendees, if you have questions throughout this webinar, we do have a Q&A session at the end of this. You can either ask them the question personally, or if you want to message one of the panelists, we can also ask the question for you. Now we're going to go on to the webinar. Just wanted to give a little introduction first. Our speaker is Dr. Jerome A. Paulson, MD, FAAP. He has practiced and taught primary care pediatrics for over 30 years. So the presentation is going to skew a little bit towards the health impacts of climate change on children, but it will also be of interest to other medical students concerning the health impacts of climate change and environmental justice. Dr. Paulson graduated from Duke University School of Medicine, did his house staff training at the Johns Hopkins Hospitals and Sinai Hospital in Baltimore, Maryland. He also served on the faculties of Case Western Reserve University School of Medicine and George Washington University School of Medicine and Health Sciences. He is currently a professor emeritus of pediatrics and emeritus professor of environmental and occupational health. At various points in his career, Dr. Paulson was a Robert Wood Johnson Health Policy Fellow working in the U.S. House of Representatives, a Soros Advocacy Fellow working for Children's Environmental Health Network, and on loan from GW to the National Health Center for Environmental Health of the CDC. Recently, he completed a term as chair of elective committee on the Council on Environmental Health of the American Academy of Pediatrics. He is a consultant to several NGOs on environmental health issues. And after that amazing introduction, we are going to let Dr. Paulson present now.
Well, hello, everybody, and thank you all very much for joining this webinar. I do want to thank Patricia Friedrich for reaching out to me and for organizing this presentation, and I want to thank the staff at AMSA for taking care of the technical details with the webinar. And I have no conflicts of interest to disclose. I'm really quite pleased that you all are part of this webinar today because you are very much the future of healthcare and medicine in the United States. Climate change and some of the other environmental topics that you're going to hear about in this series of webinars are going to be part of your professional lives and part of the issues that will confront the patients that you will care for in the future. So we're going to talk today a little bit about the causes of climate change, the foreseeable impacts on human health and particularly on kids, talk about some things that you can do as individuals that you can recommend to your patients as clinicians that may help mitigate climate change or adapt to climate change, and we'll see where the rest of that goes. So, climate and weather are two different things. Climate is the average weather over the period of about 30 years, and it's a highly complex system of things that range from astrophysics to biology, the magnetic core of the Earth, and a whole lot of other things that are not typically part of medical school or physicians' day-to-day activities. But one of the things that you will see is that there's been a great conglomeration of experts of all sorts from around the world who've come together to study climate change, and where we can, as healthcare professionals, take some information and apply it to our patients' lives and our own lives. The weather, on the other hand, is what's going on today, tomorrow, yesterday. Is it hot? Is it cold? Climate change is what happens over long periods of time. And climate has changed over the course of the Earth's existence. You can see in this photo a change in the Muir Glacier in Alaska between 1941 and 2004. That's a result of the current climate change and the particular warming that has occurred in the last 100 years. In 1941, the glacier came all the way from the mountains in the background to the foreground. Now the foreground's a lake, and the glacier that remains is that tiny little white triangle back in the background of the picture. The warming of our climate is unequivocal. On this graph, you can see three sets of data going back to the 1850s that show changes in observed global temperature. And this has not been caused solely by human beings, but human beings are a significant contributor to these changes, and that's why human beings have to be involved in the adaptation and mitigation that's going to be required to stabilize climate change and allow humans to continue to live comfortably on the Earth. The 10 warmest years of record have occurred since 2000. 2014 was the hottest year on record, and if we could stop all of the human-generated greenhouse gases, the primary drivers of climate change, today there's enough inertia in the climate system that it would take about 50 years before the system would settle down and stabilize. So there are going to be a lot of health impacts that occur as a result of the temperature change, changes in infectious diseases, changes in food sources from the heat itself. The oceans are going to rise as a result of the melting of the ice in Greenland, in the Arctic area, and in the Antarctic area. I live in Virginia, and we are already starting to see significant changes in the coastal regions of Virginia. The U.S. Navy has spent billions of dollars to adapt to climate change at Norfolk and Hampton Roads, which is the largest naval base in the world, because the sea level is rising and will continue to rise. We are seeing more severe weather events. It is never possible to tell that any particular extreme weather event is specifically related to climate change, but the frequency and severity of weather events is increasing, and that process, that flow of change is certainly due to climate change. Now, here in the United States, we are experiencing both some extremely heavy rains in parts of the country and extreme drought in other parts of the country, and that is occurring around the world. So this is the rain and the droughts are going to have significant impact on food production, migrations, access to drinking water. This is a problem that has true global impacts. And I don't want anybody to have the impression that greenhouse gases, that phrase greenhouse gases, is a pejorative word or phrase. We need greenhouse gases in order for the Earth to be habitable. Greenhouse gases are gases that up in the stratosphere allow energy from the sun to enter the Earth's systems, to be absorbed by the ocean and the land masses, and then prevent some, but not all, of the energy that was unabsorbed from radiating back into space. And if we didn't have greenhouse gases at all, this planet would be too cold for life as we know it to exist. The problem is that through human activity, we have put more greenhouse gases, predominantly carbon dioxide, secondarily methane, in the atmosphere, and that prevents some of the heat that should radiate away from doing so. And the Earth has been warming, and the systems have been perturbated. Burning of coal, oil, natural gas have all put more CO2 into the air, and then deforestation by removing a carbon dioxide sink has allowed more of that carbon dioxide to stay in the air. And if those products of deforestation are burned, then the CO2 that they've stored in their growth is being re-released into the atmosphere. And I want you to look at the far right-hand side of this graph, because you can see going back 400,000 years on the whole scale of this graph, that CO2 levels have come down, gone up, come down, gone up, but particularly in the last century or so have gone up much, much higher than they have ever been. And in fact, during 2013, carbon dioxide levels hit 400 parts per billion, which, if sustained, will certainly tip us over into the worst consequences of climate change. Children are among the vulnerable groups for all environmental health hazards, and in particular for climate change. Kids, particularly small children, have a greater minute ventilation rate than adults do. So if the air that they breathe is polluted, they breathe in more of that pollution per kilo of body weight than an adult does. They eat more food and drink more water per unit of body weight. And so if that if that food or that water are contaminated in some way, then again, the children get a greater dose of the contaminant than an adult does. They are immature, both cognitively and in their body abilities. And for example, in extreme weather events, hurricanes, floods that may result from hurricanes, the kids can't make decisions to get themselves to safety. They are totally reliant on adults in the system for that. And hopefully kids are outside more than adults, and so they can be exposed to things in the outside environment more than adults are. It is estimated that about 88, almost 90% of the existing global burden of disease due to climate change occurs in children under 5, and this is on a worldwide basis. And kids in the poorest countries are going to be more impacted by climate change, and adults in the poorest countries are going to be more impacted by climate change than will children and adults in more affluent countries around the globe. As I've already mentioned, climate change is going to affect human health through increased heat-related illness, impacts on air quality, altered disease patterns of climate-sensitive infections, physical and mental health impacts of extreme weather events, and food and water insecurity. And we are already starting to see all of these impacts in parts of the United States. For example, in Alaska, there are many changes going on today related to climate change. I've already mentioned sea level rise in Virginia, but it is also occurring in many other of the coastal areas of the United States. The mental health effects of Superstorm Sandy and of Hurricane Katrina, whether those individual events were climate change related or not, they certainly serve as a warning of the mental health and the physical injuries that can occur with those kinds of weather events. So we're seeing these impacts here in the United States as well as around the world. And all of these things interact with one another. Droughts cause malnutrition, and then they cause people to move because those people can't get food and they can't get water. And floods, the same way, cause people to move. Heat waves contribute to air pollution, and air pollution causes and exacerbates asthma, impacts on lung growth in children, exacerbates and may cause chronic obstructive pulmonary disease in adults. And as you can see, these bidirectional arrows on this image that you're looking at now, all of these factors compound all of the other factors that are related to climate change. In terms of heat illness, actually the elderly and those with mental illness are the ones who are most likely to be impacted by extreme heat events. There is data both from extreme heat events in Chicago and extreme heat events in France that document this. Extreme heat actually kills more people than any other weather-related problem in the United States. And the Intergovernmental Panel on Climate Change, which is a group that works out of the UN and has a lot of interaction with the World Health Organization and is the primary global body for studying climate change, says that it is virtually certain that there will be warmer, more frequent hot days and nights in this 21st century. The kids who are at risk are, it's a bimodal distribution, young children less than 1 year of age, because their ability to internally thermoregulate is not as good as an older child or adult. And you can see the relatively low numbers, but significantly tragic events that occur every summer in the United States of children being inadvertently left in motor vehicles and dying as a result of the rapid increase in temperature in a closed automobile. The other part of the childhood age spectrum who are impacted by heat are the high school athletes. And then when you get into young adults, it's young male adults who are working outside. So greater than 1/3 of all emergency department visits for heat injury are in teenage males. And this graph on the right side of the image is information from data collected by the CDC, and you can see that visits to the emergency department in the United States for heat-related illness is maximal in August. August in many places is the hottest month of the year, but it's also the time that high school and college athletes go back and start practicing before the academic year begins. And there are greater than 9,000 deaths and disabilities among high school athletes from heat-related illness in the United States every year. And we need to think about ways of changing practice. For example, if high school students are going to start class later in the day because that's what their biological rhythms indicate should be done, perhaps, if it doesn't disturb their biological rhythms too much, they ought to practice in the morning when air pollution is less and the air is cooler. Allergic rhinitis is an extremely common problem affecting almost 10% of all the children in the United States. It's certainly a very common problem among adults as well. And climate change leads to alterations in the growing season so that plants that produce pollen start to grow earlier in the year because the ground thaws out earlier, and they continue to grow later in the year because the first frost that would kill them is delayed until a little bit later. When plants have been grown in controlled situations in hothouses, greenhouses, higher atmospheric carbon dioxide levels are shown to increase many plant pollen production. There's actually documented evidence here in the United States that plants, that pollen, the ragweed season has lengthened. Interestingly enough, as you can see on the right side of this image in the map, the season has changed mostly in the northern latitudes where this later first frost and earlier thaw would be most pronounced, and has changed less in the lower latitudes. Plants grown in today's carbon dioxide concentrations produce about twice as much pollen as they produced at the CO2 levels of a century ago. This image is a projection of what's going to happen in some counties in New York over the next decade or so. Because of the worsening of seasonal allergies and also increased concentrations of ground level ozone that go along with climate change, it is projected that emergency room visits are going to increase by as much as 10% in certain counties in New York State over the next decade or two. And this is going to be true in other parts of the U.S. And in other parts of the world where pollen is a significant contributor to asthma. And you can see from this particular graph that's basically a dose-response curve, that the higher the concentration of ozone, the higher the rate of asthma. We've just finished a situation here in the United States where many health groups have been arguing for decreased ozone pollution limit in the United States, and the government did agree to decreasing the ozone level, but did not agree to making it as low as many of the health groups had hoped they would make it. And so there will still be problems for children and adults as a result of ozone in the atmosphere in the United States going forward. As I mentioned, it's impossible to understand whether any given severe weather event is in and of itself a result of climate change. So the hurricane that has been off the east coast of the United States over the last week, we don't know whether that hurricane, and there is no way of knowing whether that particular hurricane was specifically induced by climate change. But between 2000 and 2009, there were 3 times as many severe weather events as there were between 1980 and 1989. And some of this is related to deforestation. Some of this is related to urbanization. And as CO2 builds up in the atmosphere, then heat energy is stored in the atmosphere, and that heat energy then contributes to the creation of the hurricanes. As I mentioned, children are unable to rescue themselves in the events of the hurricanes or the resultant flooding that may occur from the hurricanes. So there's loss of life, there's a lot of family disruption as the floods destroy the infrastructure, the roads, the buildings. A lot of chemicals get into that water pollution. The water, of course, in areas where waterborne vectors grow, then of course the water contributes to the growth of those vectors. And the disruption of schools, the disruption of families with separation of family members, the disruption of families with job loss, the loss of homes, the destruction of personal property contributes to anxiety, post-traumatic stress disorder, poor academic performance going forward, and other mental health issues. The United States has probably one of the most efficient and most robust communication systems of any country in the world. Yet during Hurricane Katrina, more than 5,000 children became separated from their families, and it took almost 6 months to reunite the last of those children with their family members. And again, with the sophisticated telecommunication system that we have in this country, with the involvement of local, state, and federal governments, with the involvement of the National Guard, and all of the communications capabilities that those entities bring, we still took a long time to get kids and their parents back together again. There were over 34,000 phone calls made to hotlines for missing and exploited children, predominantly because of concerns about missing kids. There were 400 kids who were rescued from flooded homes. 11,000 children in that Superdome Convention Center complex that you may remember was used as a refuge site in New Orleans, and totally between 200 and 300,000 children who had to be evacuated and relocated from the greater New Orleans area as a result of Hurricane Katrina. As healthcare professionals, clearly one of the areas where we have a great deal of expertise, because it has been a focus of medicine since the beginning, and certainly infectious diseases have been a focus of medicine in the 20th century and the 21st century, because we had facility both from public health standpoint as well as individual health standpoint. We had capacity to deal with infectious diseases. But climate change is going to change the pattern of infectious diseases that you see as clinicians throughout your career, and we are starting to see some of those climate-sensitive infectious disease changes even today. Anytime there is a lot of rain, even if there's no flooding, patterns of diarrheal disease change, and that's true here in the United States, a country with sophisticated sanitary sewer systems, and it is true around the world in countries where they don't have sophisticated sanitary sewer systems. We are seeing changes in the distribution of the tick that is responsible for the transmission of Lyme disease, and we may be seeing changes in the distribution of the vectors for dengue and West Nile. We are possibly also seeing changes in the range the geographic range where valley fever and amoebic meningoencephalitis occur. As you can see in this image, when there's a lot of rain, it washes a lot of stuff, including feces, both human and animal feces, into the water, and also washes waste from streets and farm fields into the water, and all of these things can contribute to the spread of diarrheal disease. Diarrheal disease is the leading cause of childhood mortality around the world, with about 1.6 million deaths per year in kids under the age of 5, and it's projected that there'll be about 48,000 additional deaths per year by 2030 as a result of changes in the climate leading to changes in diarrheal disease distribution, primarily in Asia and sub-Saharan Africa. With some of the vector-borne illnesses, there are so many factors that come into play: temperature, moisture, where people live, how food and other commodities are transported locally and around the globe across international borders, that tracking vector-borne diseases and determining that changes are climate-related will be difficult, but climate change is certainly going to change habitat. It's going to change the amount of the duration during the year when mosquitoes and other vectors can replicate and spread disease. So it's going to be a confusing situation over time, but we do know that certain vectors are moving towards the poles and that they are likely to be bringing disease with them. The maps on the left side of this image, the first one at the top, looks at the distribution of TICS, T-I-C-K-S, not T-I-C-S, sorry about that, the distribution of TICS between 1971 and 2000, and then you can see the projections for the movement of the ticks that are responsible for disease into the southern tier of Canada and more ticks in the mid-latitudes of the United States. At a personal level and also based on data, one of my own biggest concerns related to climate change is what is going to happen to the quantity and quality of food around the world as the climate changes over the next 50, 80, and 100 years. As you can see from this map, the areas in yellow, orange, red, and maroon are the areas of the world where food production and the quality of the food in terms of its nutrient content is expected to decline. And as you can see, a lot of this is occurring in Africa, which is already a food insecure continent, but this is also going to occur in the United States, where we produce a lot of food for the rest of the world. India and South Asia and Southeast and West Asia are going to be significantly impacted, as will the northern part of South America and all of Central America, which is very much a source of food, fruits and vegetables in particular, for many of us here in the United States during the colder months of our year. The improvements that you see indicated in the Canadian landmass and some of the Russian landmass are not likely to be sufficient to replace the loss of food production in other parts of the world. Now, we know that plants take in CO2 and need that for growth. So in a certain sense, one might think, well, if there's more CO2 around, the plants may grow better. And I've already talked about ragweed and other pollen-producing plants related to allergic rhinitis and asthma, perhaps growing better in higher CO2 ranges and making asthma and allergy worse. So that's true, but then if that's associated with droughts, of course, if there's not adequate water, the plants aren't going to grow. And plants are temperature sensitive. They grow best within a certain range of temperatures. And when the temperature gets up above 100 degrees Fahrenheit, many plants will not grow as well as they do at more temperate temperatures. So without extensive mitigation and adaptation, we will see worsening of the availability of water and worsening of the availability of food and the quality of food that is available. Malnutrition clearly has the greatest impact on young children, but has an impact throughout the lifespan as those children who survived their malnutrition grow up stunted with decreased intellectual capacity and decreased capacity then to help their countries wherever they are around the globe. And the World Health Organization projects that 15 years from now, there are going to be an additional 95,000 childhood deaths per year due to malnutrition and an additional 7.5 million moderately or severely stunted children. And again, this will occur in the parts of the world, Africa and Asia, which already have the greatest level of these problems. Wheat, rice, and soybeans will have decreased nutrient capacity as CO2 levels increase. There will be decreases in protein, iron, and zinc in these crops as well. And we are starting to see these changes even in the crops today. Climate change is going to worsen health disparities between the rich and the poor. For those people here in the United States and around the globe who live in poor housing, when that housing is damaged or destroyed by severe weather events, those people are much less likely to have the wherewithal for replacing that housing. Poor people in countries where air conditioning is available are less likely to have access to that air conditioning, and as those countries warm and those people still do not have access to air conditioning, then heat-related deaths will increase. If individuals who have low income do have air conditioning, but they don't use it because of the cost, then again, they will be impacted by these increased temperatures. And of course, people who are low income have less access to food, and that is going to be made worse by less food being available and by food of lower quality being available. So in summary, let me say that climate change is real. It is affecting and will affect the life of every human on Earth. So every patient that you come into contact with, you yourselves, your family members, are going to be impacted by climate change over the course of your professional lives. This impact will increase over time. It's going to vary by geography. Right now, we're seeing it in the circumpolar north. We're seeing it in low-lying parts of the globe, but we are going to see it everywhere over time. Richer regions are going to have more ability to adapt to climate change, but poorer regions will not. And certainly with the displacement that occurs from drought, from starvation, from lack of water, this is going to contribute to instability around the world. We're seeing the problems in Europe that are occurring as a result of forced migration, both from poverty and lack of food in Africa and from war in the Middle East. And if the world cannot cope with that kind of migration now, what is it going to do as migration gets worse with climate change? So what do you do as a healthcare provider? What's your role? There's a lot of experience in dealing with public health issues. We've got vaccination programs, we've got water sanitation programs. There's been a tremendous impact in just my career certainly with decreased tobacco utilization here in the United States, not necessarily around the world, we've gotten rid of lead from paint and from gasoline. And so we do have a role to play in climate change. We can talk about it among ourselves. We can get educated about the problem of climate change. We can talk about it in the institutions. What are our schools and hospitals and healthcare facilities doing to decrease their carbon footprints? There are all sorts of health reasons to encourage our patients, our colleagues, our families to use active transportation and public transportation. We talk to people about their diets. We talk to people about exercise. Well, that's important for their health, and that's also important in terms of climate change. Cattle raising, not both through carbon dioxide production and methane from the cattle, increase the severity of climate change. So trying to move ourselves and our patients to a more plant-based diet is going to help to mitigate climate change. The individual in the picture in the corner on the right-hand side of this image before you is a friend and a colleague of mine, Samantha Adut. She's a primary care community pediatrician working in an office practice here in Northern Virginia, but she is also the author of the forthcoming policy statement on climate change from the American Academy of Pediatrics. And this picture was taken when she was in Richmond, Virginia, the capital of Virginia, talking at a public rally about ozone levels and the impact of ozone on human health. You physicians and other healthcare providers aren't going to be able to solve the climate change problem by themselves. They very much need to be parts of coalitions. Join with the environmental groups on your campuses. Many campuses have sustainability initiatives that come out of the office of the president of the university. Make sure that your schools of medicine are involved in those initiatives and changing as a result of those initiatives. There are many, many, many places for you to get more information about climate change, and I'm hoping that this particular information in this particular slide will be posted for you after the end of this webinar so that you have access to it. You can communicate with me at jerry@envirohealthdoctor.com, and I will now turn this back over to the moderators for any questions that you all may have. Thanks very much.
Great, thank you so much, Jerry. We really appreciate that good overview of all the different ways that climate change impacts our health and the health of our patients. I think at this time we'd like to open it up for questions. So if anyone has a question, there's a couple ways we can do this. Either you can, if you're able to unmute yourself, which I may need to unmute people, you can do that. Or if you'd like to just type your question into the chat box, I am happy to go ahead and announce those questions as they come. So. But we have some questions here. So here's the first question. Some medical students do not have curriculum that addresses the environmental health concerns we will see in our future patients. What do you recommend that we do as medical students to further our education in environmental health?
I know of several medical students who have created courses at their own schools over the years to educate themselves about various environmental health issues, not necessarily climate change exclusively, but climate change has often been a part of those discussions. I think that any of the resources that are on the screen now from the U.S. Global Climate Change Research Program, or, for example, the Lancet Commission on Climate Change and Health can serve as material that can be used in study groups. I would look to perhaps if you've got a companion school of public health, the Department of Environmental and Occupational Health in that school of public health. The American Thoracic Society is probably the most active physician medical society because climate change is it often impacts on lung disease, so there may be a pulmonary doc in your facility. The National Medical Association has been very active in climate change, as has the American Association for Asthma, Allergy, and Immunology. So on the websites of any of those associations, and if you can find faculty members in your institutions who are part of those associations, they may be able to help you develop some educational materials that you can use.
Great. Thank you, Jerry. That was very helpful. And it's nice that we have this good list of resources that you provide us as well. Thank you. Let's see. So I know Jeff has a question, so I'm going to go ahead and unmute him now. Okay, Jeff, go ahead.
Hi, can you all hear me?
Yes.
Okay, great. So the question I have is related to sort of almost the battle for the hearts and minds around climate change, and it seems like there are lots and lots and lots of communication channels and avenues that are more than happy to promote misinformation about climate change, and I'm just wondering, for physicians in training who don't necessarily have such readily available, who don't have access to to national communication channels and publications and the press, what can we do to combat the misinformation? And sometimes I wonder, even if it's like an intentional program of untruths and lies.
Unfortunately, there is a long history here in the United States and around the world of disinformation and misinformation campaigns. There have been books written about it as it relates to lead. There's an interesting book, if any of you want to pick it up, called Doubt is Their Product, that and several other books that talk about the disinformation campaigns around tobacco. I think in terms of climate change, there are two things that need to be separated a little bit. One, there is a lot of information out there, and that is incorrect, and that hopefully by providing accurate and correct information, we can counterbalance that. There is also a thread that in our country goes back to its founding over 200 years ago of science denial, and that thread is very strong. It goes well beyond climate change. We are still in certain parts of the country debating issues, for example, comparable to the so-called monkey trial, the Scopes monkey trial of the 1920s, so almost 100 years ago. And science denial, we encounter not only in climate change, we encounter it in vaccine issues and a number of other issues. It's really quite hard to deal with. There's one NGO in particular, I think many NGOs have tried to deal with the misinformation. There's one NGO in particular that is almost entirely dedicated to, well, there are two centers for this, resources for this information. One is the Center for Climate Change Communication. And so if you search for that phrase, Center for Climate Change Communication, it's based at George Mason University. And they have done quite a bit of research, both among medical personnel and among the general public, looking at how to message effectively. And then the other group is a big NGO called Eco America. It's spelled ECO in lowercase and then capital A, and then the rest of America is in lowercase. They exist solely to message to the public, and they work in the religious arena, the business arena, the medical and health professions. They work with university presidents around the country. So their process is to subdivide the population and to try and craft messages that are specific to those populations. The American Academy of Pediatrics is going to have a new policy statement and technical report before the end of the year, and hopefully we will be developing some messaging specifically for pediatricians to use with the families that they take care of, and of course that's going to be useful for family physicians, perhaps obstetricians who provide primary care to women, and perhaps to internists who provide primary care to adults. So we will try and spread that material around and not just use it in the AAP.
Thanks, that was really helpful.
Sure.
Maybe we have time for one more question. Let me just pull it up so we're just in the chat. So last question, what are some things we should address in an H&P risk patient in order to screen those who may be at increased risk for an environment-related health problem?
I think much of the information that you gather as you talk about the social situation of your patients is useful information. Getting a little more detail about where they live, not just the address, but what's around them. We know that people who are poor in the United States are much more likely to live near industrial sites, near bus barns, near highways, near incinerators. If you're dealing with adults who are very poor, are they homeless? Are they living in a single room occupancy and SRO environment? which may not have air conditioning? Are they living in public housing or Section 8 housing where they may not have access to adequate air conditioning, where maybe there's problems with mold, which is not a climate change related issue, but certainly is a common environmental health problem in poor housing. Not only where do people work, but what do they work with? You know, are they a gardener and working with a lot of pesticides? Again, not necessarily climate change related, but certainly environmental health related. So a lot of what you are learning to do now is directly applicable to all sorts of environmental health issues, as long as you take what you know and think about it in an environmental context and just don't sort of record the information on the form in the EHR or whatever without using that information to make decisions about the risks that your patients may be confronted with.
Great. Well, thanks so much, Jerry. We really appreciate that. I guess, are there any other questions at this time?
All right. Well, it's been my pleasure. I think that Patricia and others have put together a great series that you are going to participate in and have access to over the next couple of weeks. I know many of the people who will be presenters coming after me, and I think you've got a great set of presenters to look forward to, and I hope this all continues to work well for you. Thanks very much, and goodbye.
Yeah, thank you so much, Jerry. And like Jerry said, we do have events for the rest of the week. We have a webinar tonight at 8 p.m. on physician gag laws and fracking, and then we have events the rest of the week. So evening sessions and then a few in the afternoon as well. So definitely check out our website. I just posted the link in the chat box, and I will go ahead and we will also, have this recording available. If anyone just popped in and missed the earlier portion of the webinar, it'll be available online, and as will the rest of the recordings for the rest of the week. They'll be recorded. So you're all set. So thanks a lot, everybody, and have a great day. Thank you, Jerry.
Bye.
There's a couple folks who just joined the call, and I was just